Sorry.
I'm well, thank you. So I rise to support the motion put to this House by the opposition leader and member for Churchlands. I want to speak on a matter that is becoming increasingly urgent, not just for aged care advocates, but for every regional West Australian who relies on our hospital system to be there when they need it. At the heart of the issue is a basic failure to move elderly people out of hospital beds and into appropriate care, whether that's residential aged care or support at home. And that failure is creating gridlock in our hospitals, delays in emergency departments and distress for families across communities like those in Warren, Blackwood and Western Australia. Right now, around 200 elderly West Australians are stuck in public hospitals, medically cleared for discharge but unable to leave due to a lack of aged care beds and home care support, particularly outside of Perth. In 2022-2023, the WA Auditor-General found that nearly 500 people spent a combined 40,000 unnecessary days in hospital, waiting for support that never arrived. This cost the taxpayer was nearly $95 million, and the cost to those families was probably even higher. Deputy Speaker, I want to share the story of a local family from the Shire of Manjimup. It's one of many, but it sums up the heartache our community is facing. In December last year, the daughter contacted My Aged Care to arrange ACAT assessments for both her elderly parents. Her father has advanced Alzheimer's. Her mother, aged 88, was still caring for him. She was told the wait would be 3 months. The wait blew out to over 5 months due to staffing shortages. The assessments were finally completed on the 27th of May this year. Just days later, her mother fell, suffering a fractured pelvis and shoulder. She was admitted in Manjimup Hospital for treatment and stabilisation. But when her acute care needs had passed, she could not be discharged, not to her home, where she could no longer safely live, and not to residential aged care facility because there was simply no beds available. She remained in hospital because there was nowhere else for her to go. Eventually, she was transferred from Manjimup to Nannup Hospital for better care, but because her bed in Manjimup was urgently needed for another patient. This is the reality. Hospitals becoming holiday bays for aged care patients because the system beyond the ward isn't functioning. That has left a 91-year-old father alone on the farm with no in-home support and no available aged care placement. She's been told the wait for home care support is now 12 months. This family cannot meet the care needs on their own. They are working full-time, and like many others in Warren Blackwood, they feel abandoned by a system that promises aged care but doesn't deliver it. The delays we're seeing are not isolated. They span every stage of the aged care pathway. ACAT assessments in regional WA are routinely delayed by months. Home care packages, even once approved, can take over 200 days to activate. And residential aged care facilities across the southwest have long wait lists and minimal vacancies. And WA Health still lacks reliable, real-time data on which patients are medically ready for discharge, making targeted investment almost impossible. Many older people remain in hospital not because they need acute care, but because it is the only place that they can receive basic daily support. In-home service providers are overwhelmed or unavailable. Personal care workers are hard to recruit and even harder to retain in regional WA. Equipment, transport and modifications often arrive too late to prevent admission to hospital or too late to enable discharge. Doctors hesitate to send people to home alone. Families are told to wait, and older West Australians, like the Manjimup couple I mentioned, are left in limbo. Our communities are doing their best to fill the gap. Across towns like Nannup, Walpole and Boyup Brook, community resource centres are quietly running a local design model called Staying in Place. It helps seniors stay in their own homes safely and with dignity. It prevents unnecessary hospital admissions. It eases pressure on hospitals and residential aged care. But it is running on fumes, little formal funding and no long-term certainty. The WA Auditor-General found that unnecessary long-stay patients are costing the state over $2,300 per day per person, when aged care or home care would cost a fraction of that. If we solve this issue, we could free up 14,000 hospital places per year, save $71.8 million annually, and improve outcomes for thousands of families. This is not just about compassion, it's about basic responsible governance. Deputy Speaker, these concerns aren't just being raised in our communities, they've been confirmed by the Auditor-General herself. In her 2020 report, Management of Long-Stay Patients in Public Hospitals, the Auditor-General found 486 patients waited in WA hospitals for aged care or NDI services. This resulted in $95 million costs to the health system. Had those patients been moved into appropriate aged or disability care, the state could have saved $71.8 million and freed up beds for other patients. This report goes further, stating clearly that WA Health has no real-time system to track how many patients are stuck in hospital after being medically cleared for discharge. The Auditor-General also noted that in regional WA, patients awaiting aged care waited 4 times longer in hospital beds than those in metro areas. So that's 50 days in regional WA compared to 11.4 days in Perth. In closing, Deputy Speaker, this isn't theoretically, this is about abstract policy. It's not about abstract policy. It's real people right now in places like Manjimup struggling under the weight of a broken system. We must end the days where our most vulnerable are there to wait, to cope, to manage without help. We have the reports, we have the numbers, and we have the stories. What we need now is action. For the people in Warren Blackwood and the families across regional WA, I will keep calling for that action until this system delivers what it promises. Thank you.